let's talk about one of the main mechanisms of a non-contact ACL rupture in soccer. The ACL's main job is to prevent the tibia from sliding too far forward beneath the femur. Because the ligament crosses the knee obliquely, it also helps control excessive rotation between these two bones. The ACL is commonly divided into two functional bundles, the anteromedial bundle and the posterolateral bundle. Both bundles contribute to knee stability, but their tension changes depending on the position of the knee. Near extension, particularly within the first 0 degrees to 30 degrees, both bundles remain involved, while the posterolateral bundle becomes particularly taut and important for rotational stability. As the knee bends further, the posterolateral bundle progressively unloads, while the anteromedial bundle remains the main restraint to anterior tibial translation. This is important because soccer ACL injuries commonly happen with the knee slightly bent. So, what happens? The player is running forward, so the entire body carries forward momentum. To stop suddenly or change direction, the player plants one cleated foot firmly into the ground. The foot becomes relatively fixed, but the rest of the body continues moving forward. As the player brakes, the foot pushes against the ground, and the ground pushes back against the foot. This is the ground reaction force. During a cutting maneuver, part of this force acts backward, opposing the player's original direction of movement. This is the posterior ground reaction force. When the resultant ground reaction force line passes behind the center of the knee, it creates a turning effect that tends to bend the knee. To control this movement, the quadriceps contract strongly and generate an opposing knee extension moment. However, when the knee is relatively close to extension, the patella tendon pulls on the front of the tibia at an angle that creates anterior tibial shear, increasing tension in the ACL. The ground reaction force, together with the muscle forces around the knee, also creates strong compression between the femur and tibia. Because the tibial plateau slopes downward toward the back, part of this compression can create a forward sliding tendency of the tibia, adding further load to the ACL. During a sudden cut, the player may also plant the foot widely, away from the center of the body. If the ground reaction force line passes lateral to the center of the knee, it creates a valgus moment that tends to drive the knee inward. Under this combined anterior shear, compression, and valgus loading, the tibia may translate forward and rotate internally relative to the femur, increasing ACL strain even further. The ACL must resist all of these forces almost immediately. Critical loading develops within the first few tens of milliseconds after the foot contacts the ground. That is faster than the nervous system can detect an unexpected movement and generate a corrective response, for example activating the hamstrings, which protect as they pull the tibia posteriorly.